Hi, good morning, Jones. My name is Mihiraa. Let's start the warm-up session. Do you think nurses should attend continuous nursing education?
Yes, I do. The continuous nursing education program helps nurses to update themselves with the current practices in their profession. Moreover, nowadays, it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
What is your career goal after reaching your dream destination?
Right now, I do not have any clear management goals. I am very interested in learning about management and leadership and would be interested in any committees that I could participate in and learn. I have lots of ideas and would love to be in a brainstorming group, and I am very interested in the management dynamics of the organization. I feel that I need to join leadership groups to learn and meet new people.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
What are the pieces of advice for the upcoming nurses?
As a nurse, I can give a bunch of advice to upcoming nurses. Firstly, I advise them to love their profession. If anyone loves their profession, they can carry out their responsibilities in an efficient manner without complaints. Apart from that, I advise them to be dedicated to their profession and maintain professional standards. These are essential because a nurse should abide by nursing ethics on any grounds. These are a few pieces of advice that I would like to give to future nurses.
What are the qualities that a nurse should possess?
Of course, a nurse should possess a variety of qualities. First of all, she should possess excellent communication skills, which help them not only to gather clinical data, but also to maintain an effective relationship with other team members. Secondly, problem-solving and critical thinking skills are essential for nurses to deal with emergencies and difficult situations. Other qualities such as punctuality, dedication, honesty, and competency are also pivotal for nurses.
Your preparation time is over. You can now start your role play.
Good morning, Mihiraa. I can see you're looking a bit thoughtful today. How are you feeling right now, really?
A bit better than when I came in, but still worried about going home.
I hear you. That's completely understandable. Thank you for sharing that with me. I'm here today to talk through your discharge plan with you. Mihiraa, the team, and I want to make sure that when you leave the hospital, you feel confident, safe, and supported at home. So let's go through everything step by step. First, tell me a little more about how you're doing right now.
Breathing's okay sitting still, but getting up to the bathroom still leaves me winded. And I'm tired most of the day.
That's very common with COPD, especially after a flare-up. We'll make sure your home plan takes that into account. Now, about the discharge procedure itself. Before you leave, the respiratory lead will do a final review of your condition. We'll prepare a discharge summary that includes any changes to your medications and your oxygen needs. If home oxygen is still required, we will arrange for a company to deliver it to your home and show you how to use it safely. You'll also need to collect any new medications from the hospital pharmacy before you go. We'll make sure you have a 7-day supply to start with.
I never really got the hang of my inhalers, the blue one and the brown one.
I completely understand how overwhelming these different inhalers can feel, Mihiraa, and it is very common to feel a bit unsure about which does what. To make things clearer, we can think of your brown inhaler as your daily protector. Its job is to calm the swelling in your airways, so it is important to use it every single morning and evening, even when you are feeling perfectly fine, to keep your lungs steady. On the other hand, your blue inhaler is your reliever. You only reach for this one during a sudden onset of symptoms, like when you feel breathless or tight in the chest, as it works quickly to open things up. To get the most benefit, we use a spacer, which helps the medicine reach deep into your lungs rather than just hitting the back of your throat. First, you place one puff into the spacer, then take 5 slow, steady breaths in and out through the mouthpiece. Once you have finished those 5 breaths, you can then proceed with the next puff as prescribed.
I think I rushed it.
It is perfectly understandable to feel like you've been rushing, Mihiraa, as managing a new health routine can feel like quite a lot to handle all at once. Please don't worry, as many people find it takes a little time to settle into a rhythm that feels natural rather than hurried. To help make things feel more manageable and ensure you're getting the full benefit of your treatment, we can look at some very practical ways to simplify the process. For instance, using a dosage box or a Webster pack can take the guesswork out of your daily medications, as each dose is pre-organized for you. You might also find it helpful to set gentle alarms on your phone or a kitchen timer to remind you when it is time for your inhalers or nebulizers, allowing you to pause and take your time without feeling pressured. Additionally, involving a family member or a caregiver can provide that extra bit of support and encouragement during the transition. Mihiraa, are there any other concerns or questions?
Yes. Is there anything that I should look after to prevent further complications?
That is a very important question, Mihiraa, and being proactive about your health is the best way to stay well and avoid returning to the hospital. To keep things on the right track, it is helpful to become an expert on your own symptoms by watching for any small changes that might signal a flare-up. For instance, if you notice that you are becoming more breathless than usual during your daily activities, or if the color of your phlegm changes from clear to a darker yellow or green, these are signs that your lungs might need a bit of extra help. Along with monitoring these signs, staying connected with your healthcare team is essential for long-term success. We will arrange for you to attend pulmonary rehabilitation sessions, which are wonderful for building your strength and lung capacity in a safe environment. You will also have regular appointments with your GP to review your progress and ensure your medications are working effectively. If you feel ready to discuss it, we also have excellent smoking cessation support available to help take that extra pressure off your lungs. Are there particular aspects of the transition that are causing you to feel anxious?
Well, nurse, I am worried about continuity of care after discharge.
It is completely natural to feel a bit anxious about leaving the hospital, Mihiraa, but I want to reassure you that you will not be managing this journey all by yourself. We have a very clear system in place to make sure that your care continues smoothly once you step through your front door. First, we send a digital discharge summary directly to your GP. which contains all the details of your treatment and the progress you have made here, so they are fully updated before your next visit. We are also arranging for a community respiratory nurse to stay in touch with you. They are specialists who can visit or call to check on your breathing and offer guidance in the comfort of your own home. This creates a bridge between the hospital and your daily life, ensuring you always have a professional to turn to. Our main goal is to make sure you feel safe and supported every step of the way. With all of that in mind, are there any other final questions or small worries on your mind before we finish?
That does make me feel better. Thank you for explaining everything in detail.
It is wonderful to see that you are feeling more at ease, Mihiraa. To ensure everything is clear before you head home, let's quickly recap the main points of our discussion today. We started by looking at your current recovery, noting that while your breathing is stable at rest, you still feel tired and winded with movement, which we will continue to monitor closely. Your transition home involves a final check by our respiratory lead and a digital summary sent straight to your GP, so they can pick up right where we left off. Regarding your medications, remember that your brown inhaler is your daily shield against swelling and should be used every morning and evening, while your blue inhaler is there specifically to rescue you during sudden breathlessness. Using your spacer with the 1 puff, 5 slow breaths technique will ensure that medicine goes exactly where it is needed. To make things easier, you can use a Webster pack or phone alarms to stay on track without feeling rushed, and don't hesitate to lean on your family for support. Moving forward, keep a close watch for flare-ups or changes in phlegm color. And remember that your upcoming pulmonary rehab and visits from the community respiratory nurse are all designed to keep you safe and supported. You have a dedicated team behind you, both here and in the community, to help you stay well.